A hunter in the Paleolithic era stumbles back to camp, his leg torn open by a boar's tusk. Blood soaks the earth. His companions gather moss, honey, and leaves. They clean the wound, pack it, and bind it with bark strip. Now imagine a modern emergency room. The same principles apply: clean, protect, heal. The difference? Thousands of years of trial, error, and observation. This is the story of how early humans treated wounds. It's a tale of ingenuity born from necessity, passed down through generations. From moss and honey to sterile gauze and antibiotics, the core idea remains unchanged. Stop the bleeding, prevent infection, and let the body heal itself. One of the most common remedies was honey. Archaeological evidence shows that honey was used as a wound dressing as far back as 8,000 years ago in Georgia. Honey's natural antibacterial properties, high sugar content, and low pH create an environment where bacteria cannot survive. It also draws moisture out of the wound, reducing swelling. Another powerful tool was moldy bread. Ancient Egyptian medical papyri, like the Ebers papyrus from around 1550 BCE, describe applying moldy bread to wounds. The mold, likely penicillium, produced natural antibiotics that killed bacteria. This practice was used for thousands of years, long before Alexander Fleming discovered penicillin in 1928. Plants were also essential. Yarrow, for example, was used by Neanderthals over 60,000 years ago. We know this because dental plaque from Neanderthal remains contain traces of yarrow and chamomile. Yarrow contains compounds that reduce inflammation and stop bleeding. It was so effective that it remained in use well into the Middle Ages. Perhaps the most surprising remedy was the use of copper. Ancient Egyptians used copper salts to sterilize wounds and drinking water. Copper ions are toxic to bacteria, fungi, and viruses. Today, copper alloys are used in hospitals for touch surfaces to reduce infection. What early humans discovered through trial and error, modern science is now confirmed. Archaeological evidence shows that Neanderthals used medicinal plants as far back as 60,000 years ago. Dental plaque from Neanderthal remains contains traces of poplar, which contains salicylic acid, the active ingredient in aspirin. They also used penicillium mold, a natural antibiotic, though this knowledge was passed down through generations, refined by observation and necessity. By the time of the first civilizations, wound care had become a sophisticated practice. But the most remarkable ancient medical text comes from Egypt. The Edwin Smith Papyrus, dating to around 1600 BCE, describes 48 surgical cases with astonishing precision. It details wound closure using linen strips and adhesive plaster, and even recommends honey and moldy bread. The papyrus also describes how to treat a broken nose, a dislocated jaw, and even brain injuries. It shows that Egyptian physicians understood the importance of cleanliness and the dangers of infection. The foundation was laid long before by people who had only their senses and experience to guide them. In a world without hospitals, a wound was a life-threatening event. The stakes could not be higher. Consider the case of a Neanderthal man known as Shanidar I. He lived to be about 40 or 50 years old, elderly for his time. He had a crushed eye socket, a withered right arm, and a deformed foot. He was partially blind and likely in constant pain, yet he survived for years. He was partially blind and likely in constant pain, yet he survived for years. His injuries would have been fatal without the care of others. This is the earliest evidence of true medical compassion. Blind and deaf, yet he survived for years. This tells us two things: his community cared for him, and they had effective wound care to prevent fatal infections. Another famous case is the Iceman, Ötzi, who lived around 5,300 years ago. He carried medicinal mushrooms and had tattoos that may have been therapeutic. The birch polypore mushroom has antibacterial and anti-inflammatory properties. Ötzi likely used it to treat wounds and parasites. These individuals are not just fossils. They are evidence of human resilience and the birth of medicine. Their survival was not luck. It was the result of knowledge accumulated over millennia, and that knowledge was about to be written down. The first written medical texts appear in Mesopotamia and Egypt around 4,000 years ago. They document centuries of oral tradition. The Ebers papyrus from ancient Egypt around 1550 BCE contains over 700 remedies. Many are for wounds. One recipe calls for mixing honey and crushed herbs to create a paste for open wounds. Honey, we now know, has natural antibacterial properties. The Egyptians didn't know about bacteria, but they knew honey worked. This is the pattern of ancient medicine: observation, trial, error, and transmission. The same pattern appears in Mesopotamia, where clay tablets list hundreds of symptoms and treatments. A headache? Crush a mixture of poppy seeds and juniper berries. A fever? Apply a cold clay compress. These were not but ancient medicine was not just about plants. It was also about surgery. The Edwin Smith papyrus, dating to around 1600 BCE, describes 48 surgical cases. It details wounds, fractures, and dislocations. The text is remarkably rational. It classifies injuries as treatable, contestable, or untreatable. This is the first known attempt at medical triage. The surgeon is advised to examine the patient carefully, to feel for broken bones, and to clean wounds with wine. Wine, another natural antiseptic. The papyrus even describes the brain, noting that injuries to one side of the head can affect the opposite side of the body. These texts were not just medical manuals. They were the first systematic attempts to understand the human body. They represent a shift from magic to observation. The Egyptians and Mesopotamians still believed in gods and demons, but they also believed in evidence. They tested treatments. They recorded results. They passed on what worked. This is the foundation of evidence-based medicine, and it was built not in a single flash of genius, but over centuries of careful observation. The Ebers and Edwin Smith papyri are not just ancient documents. They are the first calls for a mixture of honey, grease, and lint to clean and bandage wounds. Honey's antibacterial properties are now well documented by science. Another remedy uses moldy bread, which contains natural antibiotics. This same principle led to the discovery of penicillin in 1928. The ancient Egyptians also used willow bark, which contains salicylic acid, to reduce pain and inflammation. In China, the Huangdi Nijing, or Yellow Emperor's Inner Canon, written around 2,500 years ago, describes wound. In India, the Sushruta Samhita, dating to around 600 BCE, details surgical techniques including wound closure with sutures made from horsehair or plant fibers. These texts reveal a global understanding of wound care that was remarkably advanced. But perhaps the most astonishing prehistoric medical practice is trepanation, drilling holes in the skull. Trepanation has been found on skulls from Europe, Africa, Asia, and the Americas, dating back as far as 10,000 years. Healed edges on many skulls show that patients survived the procedure. Survival rates may have been as high as 50 to 80%. The purpose? To treat head injuries, relieve pressure, or perhaps release evil spirits. The exact reason remains uncertain, but the skill required is undeniable. Trepanation is evidence of sophisticated surgery. How did early humans learn these techniques? Through observation of animals, trial and error, and the slow accumulation of knowledge. Insects, for example, may have provided early lessons in surgery. Some ants perform amputations on injured nestmates, biting off damaged limbs to prevent infection. Early humans could have witnessed such behavior and drawn parallels to their own injuries. Beyond surgery, early humans learned to use plants for medicine. They observed animals eating specific herbs when sick and experimented themselves. This knowledge was passed down orally, becoming the foundation of herbal medicine. Over generations, they identified plants that reduced fever, stopped bleeding, or eased pain. Some of these remedies are still used today. This slow accumulation of knowledge was not written down. It was stored in memory, shared in stories, and refined through practice. Each generation added its own discoveries. By the time of the first civilizations, humans had a rich pharmacopoeia and surgical toolkit. They understood the healing properties of willow bark, which contains salicylic acid, the precursor to aspirin. They used honey as an antiseptic. They set broken bones with splints. Medicine was born not in a laboratory, but in the daily struggle for, and animals use plants to treat wounds. Early humans watched and learned. They also experimented. If a certain leaf reduced swelling, they remembered. If a moldy poultice prevented infection, they repeated it. This empirical approach laid the foundation for modern science. By the Bronze Age, wound care included sutures, antiseptics, and even prosthetics. An ancient Egyptian mummy from around 3,000 years ago has a prosthetic toe made of wood and leather. Wound care was not merely about closing wounds. It involved understanding infection, using honey as an antibacterial, and applying willow bark for pain. These practices were passed down through generations, refined by trial and error, a luxury reserved for the elite. Common people relied on folk remedies and local plants. Yet, the knowledge accumulated over millennia became the bedrock of modern medicine. Every bandage and antibiotic we use today owes a debt to those early just about survival. It was about restoring function and quality of life. The Greeks and Romans built on this knowledge. Hippocrates, around 400 BCE, emphasized cleaning wounds with wine or vinegar. Galen, the Roman physician, used silk sutures and developed a system for classifying wounds. But the core principles remained the same: clean, protect, heal. When the Roman Empire fell, much of this knowledge was lost in Europe, but it survived in the Islamic world. Islamic physicians like al-Zahrawi wrote detailed manuals on wound care, describing cauterization and the use of catgut sutures. This knowledge would later flow back into Europe. Physicians like Ibn Sina or Avicenna wrote medical encyclopedias that preserved and expanded ancient wound care techniques. His work, The Canon of Medicine, was used in Europe for centuries. Meanwhile, in the Americas, indigenous peoples developed their own sophisticated wound care. The Aztecs used maggots to clean wounds, a practice now known as maggot therapy. They also used the sap of the agave plant, which has antiseptic properties. In North America, Native Americans used yarrow, a plant that stops bleeding and reduces inflammation, to treat wounds. Echinacea and golden seal were used by Native Americans to treat wounds and infections. These practices were not primitive. They were the result of careful observation and passed down knowledge. Today, modern medicine is rediscovering many of these ancient remedies. Honey is now used in clinical settings for wound dressings. Maggot therapy is used for chronic wounds. Willow bark led to aspirin. The line between ancient and modern is thinner than we think. But we must also acknowledge the limits of ancient medicine. Ancient remedies were not always effective, and some were harmful. But they laid the foundation for the scientific medicine we rely on. Many treatments were ineffective or harmful. Bloodletting, for example, was practiced for centuries and often did more harm than good. And without germ theory, early humans could not understand infection. They attributed disease to spirits or imbalances. Yet, despite these limitations, they achieved remarkable results. The history of wound care is a testament to human curiosity and resilience. From a Neanderthal applying moldy bread to a wound, to a modern surgeon using honey dressings, the story continues. The thread is unbroken. We owe a debt to those early healers who, with no training but their own experience, kept the flame of knowledge alive. Next time you clean a cut and apply a bandage, remember, you are continuing a tradition that is tens of thousands of years. The tools have changed, the principles have not. And that is the true legacy of our ancestors, not just survival, but the relentless pursuit of healing. From the first splint made of a broken branch to the sterile bandages of today, the impulse to ease suffering is a constant across time. And that is the true legacy of our ancestors, not just survival, but the relentless pursuit of healing.